Union, which is being held right here in Addis Ababa in Ethiopia. My name is Wayne Musabayana. I'm Head of Communication at the African Union Commission. So today we have two panelists. The first one is Dr. John Nkengasong, who is the Director of the Africa Centers for Disease Control and Prevention, and he's sitting in the studio. The other panelist is a distinguished doctor and a professional. She is Dr. Olive Shisana. Dr. Shisana currently serves as the Special Policy Advisor to the President of South Africa, and she has been in this post since 2018. And in this role, she has a line of sight of several areas, including health, COVID-19, gender, education, and social development. Dr. Shisana is an honorary professor at the University of Cape Town in South Africa and was awarded the Doctor of Laws Honours Causa degree by Monash University. So we want to welcome Dr. Shisana, and we will be hearing from her not very long from now. So in our briefing for today, as you've heard, this is a special edition of this press briefing, and it's a hybrid in the sense that we have a live audience of a group of journalists who are with us in the studio, but we also welcome questions from colleagues who are joining us online. The agenda for today. So Dr. John is going to brief us. He's going to talk about the summit, what is happening at the summit. He's going to talk about the organization of the summit and the arrangements, the health security measures that were put in place by the Africa CDC to make sure that the infections do not get, we don't have a lot of infections for this summit, and that everything is under control. He will talk to us about the 5th anniversary of the Africa CDC. I think you're aware that last week or the week before, we reached that milestone of 5 years since the formation of the Africa CDC. Then he's going to to talk to us about the report that was given by His Excellency President Cyril Ramaphosa, who is the champion of COVID-19 for the African Union. He briefed his fellow heads of state right here in Addis Ababa, and his report was on, it was a progress report on the African Union's response to the COVID-19 pandemic in Africa. So Dr. John is going to unpack what President Ramaphosa said. And then finally, we will invite Professor Shisana to join us, and she is going to talk about the COVID Commission, which is chaired by His Excellency President Ramaphosa. So after that, then we'll get into our usual question and answer section. And for that, please use the WhatsApp number +251 94 550 2310. +251 94 5502 310. Alternatively, you can come through live and also on the question and answer section. And for colleagues who are in the studio, you can just raise your hand and you can put forward your question when you have been asked to do so. So let me now hand over to Dr. John Nkengasong for that briefing for today.
Thank you, Wayne, for the kind introduction, and colleagues, it's truly a pleasure to be with you face to face. We have been doing this for the past 2 years online, and we've all become colleagues and combatants in the fight against the terrible pandemic of our time, which is COVID-19. And the fact that we are here face to face is a symbol that we are making progress in the struggle and fight against COVID-19. And it also, in my view, offers hope that if we continue to do the right things and implement the new public health measures and also new interventions and use them appropriately, then we can continue to remain hopeful that one day life will return to the pre-2019 where we had our normal life. So, for me, this is extremely emotional because for 2 years we have been seeing each other online. So when the head of states on, I think, January 15 has their bureau meeting, and they reached out to Africa CDC, they said, to advise if the conference can take place in person. We work through the science. We look at the epidemiologic data. We factored in the current situation we are dealing with, which is the Omicron, which, as you know, transmit very quickly or faster, but it doesn't necessarily correlate with the severity of disease. Then we analyzed the data in South Africa very, very carefully, and we saw how it peaked in South Africa and how the number of what I call severity that occurred during that period. So we came to the conclusion that we were advised that it was possible to have a COVID-free summit. So they took that decision to have this summit face-to-face. So what are some of the things that we did? So I've explained the science behind why we did that. We said, if Omicron is transmitting quick or faster than the Delta virus, then there are a series of things that we can put in place. We advise that there must, and I use must deliberately, everyone coming to the summit should have an N95 mask. We know what the N95, which you all have, does. It has a greater ability to prevent transmission than the other masks that we usually have. That's why you see everybody with an N95 mask. So we're taking care of that transmissibility component of it. Then we also said, if you are going to come, you should first of all start from your destination point with a negative PCR test. And then on arrival, before you get into the summit, you must do an antigen test, the rapid test, and we do that daily. I think it was a heated debate and a burden also, but we stood firm. We said, we want to be sure that we understand the kinetics of infection during the summit, so that when we pronounce ourselves and we said that the summit was COVID-free, we back that with science. So that's why we work very closely with the medical services. And on this point, I really want to single out the Department of Medical Services at the AU for the extraordinary work they have done across the summit, different testing points to facilitate that we all are tested daily and before you get into the summit. So we also encourage the head of states and the delegations to get vaccinated. As I've argued before, if anyone wanted to be vaccinated at this point in Africa, you can actually be vaccinated because we know where the vaccines are. The vaccines are coming in a more predictable manner. Then we all agree that in the meeting room, in the Mandela Hall and other places, there must be social distance. That is why the seats that you see, there is an X in between seats, and you see that across the whole conference center. There are sanitizer stations around. I mean, you see people actually, Africa CDC staff are all been deployed. You see them with the green jackets from the time you get into the hall to the AU compound around, and they're all manning stations there with the green jackets there. So they're out there like troops. They probably had troops making sure that the safety, your safety, our safety is ensured. So, and this is the exciting point. I want you to take note of this. So what is the data? I mean, I know you say it shows the evidence that it's truly been a COVID-free. So I'll give you data for the 3 days running, what we have found. And the data for yesterday is still coming in because we synthesize that and look at that, analyze it, scrub it before we present. On the 2nd of February, when delegates started coming, we tested 1,708 people. And of that number, 6 individuals were positive. We extracted them, which means they stay in the hotel and until they clear the virus. On February 3rd, when large number of people started coming, we tested 2,075 people, and 12 were positive. And all of that is the second and the third represents a 0.6% both positivity rate, which is extremely, low, I think. So we did the same thing. We took out the 12 individuals quietly, and some of them, of course, included officials. But I'm very pleased with the cooperation that we had with even the officials that were infected. On the 4th of February, 1,649 people were tested and 7 were positive, giving you almost the same positivity rate of 0.6. So our positivity rate has been around 0.6 of the thousands that we have tested. So isn't that amazing? That we could have imagined that we'll bring large number of people and put in measures, severe measures, and really restrict the transmission of the virus there. So in my view, there's a saying in public health that you never predict the future, but I can say that this summit has become a game changer in the way that conferences or such meetings will be organized on the continent, where if people actually follow public health measures very strictly, there's a lot you can do. But you need to have a whole strong health security apparatus around so that people can be, infections can be reduced. So I just wanted to be totally open with you with that information and share that so that when people say, oh, isn't this summit, what did they say? They call it a transmission event or a super spreader event. I mean, you can at least know what the numbers are. So that is that. The second thing I wanted to reflect with you has been the Africa CDC's 5 years anniversary. Africa CDC turned 5 years on January the 31st. And it's just amazing how 5 years have gone and what remarkable journey Africa CDC has gone through. But I must acknowledge the remarkable leadership of Chairperson Musa Faki Mohammed, who believe entirely in Africa CDC. I must also recognize the extraordinary belief and commitment in our head of states, including especially President Ramaphosa, who really, I would say that when he became the chair of the African Union 2 years ago, took Africa CDC from just a small organization and championed the cause of making it truly a public health agency for the continent. He is the one who actually made it possible so that every month the Africa CDC briefed the head of states on the pandemic, and we work together to develop strategies and everything that we've done in a coordinated fashion. You've also seen Africa CDC in play in so many countries, supporting outbreak controls in DRC. I think in the last 5 years, we've been in DRC in more than 10 times, supporting the governments to fight Ebola in North Kivu, in the Equator and other parts of the countries, and many other African countries. So it's truly, as the head of states were saying, remarked yesterday, Africa CDC has become a global public health institution, has become a recognized health agency for the continent, for member states, and their support is extremely valuable. It is based on that, colleagues, that they are working on a very ambitious project to transform Africa CDC in several ways. First of all, what they have in front of them now is the opportunity to make a decision at the end of this summit that will make Africa CDC an autonomous health agency for the continent. Africa CDC now is a specialized technical institution. So the goal is to elevate that into a full public health agency for the continent, which should be more or less autonomous. So I think that is one of the outcomes of this meeting that is being discussed. The Executive Council also discussed that at length, and the head of states are picking that up, and a resolution will pass on that. They're also looking at ways to elevate the reporting mechanism so that Africa CDC reports directly to the head of states, so that because they are beginning to see diseases as a security threat for the continents, and they want to have a full, timely access to anything that happens within the continent so that they can provide policy guidance. So I think that is extremely encouraging. It comes at the 5th anniversary of Africa CDC. The last thing I'd really like to talk to you about, and then we transition to Professor Sisana, is the report that the COVID champion, whom you know is President Cyril Ramaphosa, presented yesterday to his peers, and it was endorsed unanimously. And I'll just give you the summary of that report, which again will capture some of the things that have been discussed. So there are a series of those. First of all, the report, in that report, he is a COVID champion, and he has set up or we are working with him. We've set up the COVID Commission, which Professor Susanna will expand on. But there are a series of things that were endorsed in the report. First of all, there's a consensus that the head of states and government will provide increased support and leadership for COVID vaccination in 2022, such that the continent will accelerate the vaccination and get to the 70% target. Second, President Ramaphosa, as part of the commission and his role as the champion, is proposing to the other head of states the need to have an African pandemic preparedness and response authority within the African Union and the Africa CDC. The African Pandemic Preparedness and Response Authority will empower the African Union Commission and CDC to better coordinate, cooperate, collaborate, and coordinate our efforts across the continent and communicate that with an authority and a mandate. So far, the things that we have done have been based, essentially, the networking that was put in place to fight COVID was truly based on the goodwill of the countries, not based on an authority. So this authority would need to go through or a need to have a treaty that will make sure, enforce that this authority is actually implemented. For example, at the start of the pandemic, you had some countries saying, well, we don't have COVID in our country, et cetera, et cetera. With such an authority that, the EU and Africa CDC might actually engage more directly with the countries to see what is going on there. So I think it's a very good thing. We set up platforms like the AVAD, the African Vaccine Acquisition Task Team, as is known, the African Medicine Supply Platform, the COVID Response Fund. Again, those were based on reaction, based on the need at that time, but not based on an authority that empowered us to do that. So I'm very excited with that piece. Based on that, there's the head of states from the president's report agreed that they will establish an African Epidemic Fund. And that will be an upgrade of the COVID Response Fund that is currently in play, to the extent that if that fund is actually operationalized and raise resources, it will be similar to the Peace and Security Fund at the AU, which will allow Africa CDC and the African Union Commission to go in and react quickly once pandemics hit the continent or any disease threat hits the continent. The next very important piece was the operationalization of Africa CDC, which I've explained already. The key elements there is elevating the status of Africa CDC, reporting to the highest level of the continent, and giving it more authority and autonomy. So the head of states endorsed that as well. Then President Ramaphosa is calling for the establishment of the AU Health Workforce Task Team, a task team that will come together and evaluate the health needs of the continent and then set some targets on how we should work collectively to achieve those targets. I'll just give you one example. We need 6,000 epidemiologists on the continent. We only have 1,900. This is a continent of 1.3 billion people. So if we really want to be prepared for the next pandemic, we need to expand that. So this is why the president is calling for the establishment of this team that will define our needs in the areas of health workforce, and we worked to provide a competent based workforce. We're also looking at community. As part of that will be a whole spectrum of community health workers, because we've seen the power of the community during this pandemic to fight outbreaks. Then the president tabled the outcome, the resolutions, or what we achieved during the first conference on on public health in Africa. If you recall, on December 14 and 16, we convened a meeting where 17,000 participants took place, and we agreed that the continent would need to embrace a new public health order. The president also reiterated that and presented that to his peers yesterday. And they all agreed that that new public health order will enable the continent to do 4 things. 1, to expand manufacturing of both diagnostics, pharmaceutical, and vaccines. 2nd, to strengthen public health institutes across the continent, like what you have in Nigeria, the Nigeria CDC or the Ethiopian Public Health Institute, the president's vision is that all member states should have that, so that we have like the mini response centers across each country. Also the workforce development, and then domestic financing of that, and respectful partnership as he frames it. The president also, in his report, really recognized that the African Medicine Agency has been, there's a treaty now, but then he's asking for a rapid operationalization of that. And then he ended the report by thanking so many people that have worked tirelessly over the last 2 years in the fight against HIV/AIDS as part of the team that he put together, including Strive Masiwa, Benedict Orama, the president of the Afri-Exim Bank, Dr. Vera Songwe, the executive director of the United Nations Economic Commission for Africa. So that is the essence of the report. There's a long report that I'm sure the AU put online, but I just wanted to be sure that in the spirit of true partnership and collaboration, that I share the outcome with that with you. So Win, that is it for me. Over to you.
Thank you very much, John. Colleagues, I think you've heard a lot about the progress that is being made, not just for today, but for tomorrow, in terms of how the continent intends to handle pandemics such as the COVID-19 and many other health issues. So thank you very much there to Dr. John Nkengasong. We now call upon Dr. Olive Shisana. I have already given you her brief, her profile, and she's online and she's waiting to talk to us. And she will be speaking to us about the African Union's COVID-19 Commission, its work, and the members of that commission. So Dr. Shisana, good morning or good afternoon. I'm not sure where you are, but we can see you. So please take the floor.
Okay, good morning, everyone. And it's a great pleasure to be here with you this morning from South Africa in Cape Town. I'm going to talk about the commission itself. You have given us an opportunity to share with you who we are, why this particular commission, and also what it is that it has accomplished. So let me start by sharing with you who the commission is. This commission is a panel of 14 health and social experts from all the regions of the continent. They are health experts in their own right. It was established by President Ramaphosa following his appointment as the AU champion on COVID-19. It's supported by the Secretariat, which is based in the Presidency for Political Arm, but in terms of technical arm, it is based at the Africa CDC. And we're very pleased that this cooperation between the Africa CDC and the Presidency of South Africa has enabled us to really operationalize this decision of setting up a commission. Why do we have this commission? Well, when President Ramaphosa was a chair of the AU in 2020, he established about 12 initiatives which were meant to respond to COVID-19 as it spread through the continent. This included the establishment of the Joint Continental Strategy for COVID-19. The African Medicine Supply Platform was also established. Also, the Africa Vaccine Acquisition Task Team and Trust, and the COVID-19 Relief Fund that Dr. John Nkengasong has just mentioned, as well as the African Vaccine Delivery Alliance, as well as others. Now, his chairship of the AU, it ended at the time when the pandemic was still raging. The AU then appointed President Ramaphosa as the COVID-19 champion, essentially to maintain momentum on the initiatives that he had established. Around the same time, the Independent Panel for Pandemic Preparedness issued a report calling on the world to be more organized and begin to prepare for future pandemics now. It called for tighter coordination between countries, between regions, and established entities. The African continent's leaders and citizens, really having suffered significant inequities and discrimination during the pandemic, made a clarion call for Africa to gain biotech sovereignty, strengthen health systems, and also grow the health workforce while building the health infrastructure. Now, having considered all of this, it was clear that it was not enough just to pursue a championship of patronage, but to establish a program of action that would continue to respond to the ongoing pandemic while steering a strategy of building back better, and preparing for future health emergencies. President Ramaphosa established the commission to support such a program of action, to ensure that it is built upon the foundation of evidence driven by the best minds in the continent. They've accomplished a lot since they started. They divided themselves into 5 working groups to focus on African recovery, on diagnostics and therapeutics, on gender and stigmatization, on vaccine enterprise, as well as resource mobilization. They have mobilized about $11.5 million on pledges today to support the projects under the commission. And the aim is really to establish a pandemic preparedness instrument that Dr. John Kangasan talked about that will be binding to secure the collaboration of member states upon the declaration of a public health emergency of regional concern, irrespective of the leadership or politics at the time. So it's a long-term thing. It's a visionary, step that they've actually taken. It will be called the Africa Pandemic Preparedness and Response Authority, which will be the one that Dr. John Kangasan indicated that it will have the power to harness the full capabilities of the structure that is established during the COVID-19 pandemic. The establishment of APRA will ensure a very predictable and structured mechanism to stock and deploy medical countermeasures, financial resources, the workforce needed, and predetermined strategies in the event of a health emergency of regional concern. It will also upgrade the present COVID-19 relief fund, which Dr. Kangasan mentioned. It will do so, make it to become a health emergency fund, having learned from the merits of pooling as a mechanism to secure medical countermeasures and support countries during health emergencies. After consultation, the Commission has proposed the establishment of a health workforce task team to operationalize the Africa CDC's framework for public health workforce development 2020 project through a social compact established in concurrence with member states. The Commission played a crucial role in the first conference on public health in Africa, which galvanized leaders and sovereign and society around the new public health order. The Commission played a strategic role in the imminent introduction of Paxlovid as well as Molnupiravir, negotiating for timely delivery of and access to the oral therapeutics, for the continent. It made strategic inputs to the enhanced surveillance strategy, which so far has seen 12 million rapid antigen tests done on the continent. Our target is 200 million rapid tests by the end of 2022, so we can know what is really true status of COVID-19 in Africa. The Commission has driven the strengthening of digital surveillance system through a public-private partnership with Microsoft. It also initiated 3 pilot projects. The first one was on integrated services to recover non-COVID-19 services. As you know, that when people focus on COVID-19, the other services really fell behind. Secondly, to establish the digital surveillance, which will form the basis of a national public health institution. And thirdly, to recover sexual reproductive health services through a public-private sector partnership. The Commission also approved the establishment of an Africa Alliance for Health System Strengthening. Now, this alliance is going to target incremental gains towards member states spending 15% of their budget on health, as per Abuja Declaration, and peer support to use the special drawing rights and other financial instruments to strengthen health systems. It mobilized funds for the AMA to establish its foundational team. And then it provided strategic support to the Partnership on Africa Vaccine Manufacturing, the PAVAM, to produce 60% of vaccines for Africa by African manufacturers. It also provided strategic and resource mobilization support to the WHO mRNA Hub, Tech Hub, which is in South Africa. As indicated, this was presented yesterday by the champion, and it was endorsed by the African Union. Thank you very much for your attention.
Much. That was Professor Shisana speaking to us from Cape Town in South Africa. Thank you, Prof. All right, colleagues, we have now come to the point where we have our question and answer section. You heard the professor there really telling us about the vast amount of work that is being made, that is being put in to make sure that Africa is ready for any pandemics or other public health issues that may come along after this. And she has also provided the network that is being put in place. I think she has made interlinkages between different agencies and exactly what they will be doing. So thank you very much, Prof, for that. So for our question and answer section, as I have said, we have two types of audiences today. We have the audience that is in the room, which will indicate their intention to ask questions by raising their hands. And then we also have an audience that is online. And as usual, they can use the WhatsApp number +251 94 550 2310. They may also choose to come through online and also to put their questions on the question and answer section. Let me start with the audience in the room. Do we have any hands? All right, I see a hand going up there, and I see a hand here, and another hand here, and another one there. So perhaps let's take two colleagues at a time. I think that that is Coletta, all right? And then we come to this side. So you two start, and then we'll take the others. So please tell us your names, your agencies, and then ask your question. Because of time, please try to restrict yourselves to one question per person. Coletta.
Thank you very much, Madam Wine. Dr. Nkingas, on the issue of endorsement that we've got from the African Union heads of state, we've talked about epidemic, creating an African epidemic fund, as well as AFRA. All this require money. And where we are already, the continent is struggling with also funding other things. For example, the Peace Fund. Did the heads of state at least talk about how they're going to specifically fund some of these agencies, new agencies that are coming under the epidemic issue and the fund too? Did they talk about that? Thanks.
Now, the authority, the African Preparedness and Response Authority, is still being, as you heard from Professor Susanna, it has been presented and it's still being discussed. So the concept is endorsed. Now it has to go through the appropriate channels so that it leads to a treaty. So that is just the authority that gives the Africa CDC. There's no money behind that. There's no money need behind the authority. It's a coordinating mechanism. The Pandemic Response Fund is an upgrade of the COVID Response Fund. If you recall, at the peak of this crisis in 2020, President Ramaphosa set up the COVID Response Fund, and at some point we have raised about 200 million, which we use in supporting member states to respond to COVID. Of course, the money has since gone down. However, we recognize that if you do not use that as a basis and upgrade that, then you are restricted to COVID funds. So I think the concept is to upgrade that and use all kinds of instruments, working with the private sector in Africa, mostly working with donors that are ready to put resources into it. If you recall, there's a global dialogue to have the financial intermediary fund for pandemic response. That will probably be housed at the World Bank. But what we're arguing is that as a region, we need to have a regional approach, which is closer to where the issues are. So the most important thing and the urgent thing, Coletta, is to have a structure, an instrument that can be used as a vehicle to collect and more mobilize additional resources. I have absolutely no doubt that everyone who has seen the devastation that this virus has caused on the continent will not hesitate to contribute to such a fund that can be used in future. There will be another pandemic for sure. When, I don't know. And nothing says that another pandemic cannot happen in the middle of this pandemic, right? So we just better get ourselves organized so that we are not surprised.
All right, thank you. We come across the room. Can you go to a microphone?
Thank you. Robbie with AFP. For Dr. John, you mentioned in the meeting yesterday that there was a consensus among heads of state to provide increased support and leadership for vaccination. But was there any specific measure that the heads of state agreed to expand vaccine access? What do you think heads of state should be doing? And what are the biggest obstacles at this stage to hitting 70% by the end of the year? Thank you.
No, thank you, Robbie. I think the head of states do not usually go to that level of this. What they do is they agree on a commitment, the principle of their own commitments to the project. Then they'll turn to us and say, give us what we need to, tell us what we need to do. And we are going to be proposing a couple of things to the head of states. One is that they should support a youth movement that we are creating. That is, we are calling it Youths for COVID Vaccine in Africa, working with the youth department here at the AU, so that you mobilize the youth. If you look at the structure of our population in Africa, the 1.3 billion people, 70% of the people are less than 30 years old. So that is very important. The median age is 19 years. So if we do not engage this segment of the population actively to own it and lead these vaccination processes, will go nowhere. Okay, I can make a case that the older people like us have been vaccinated a long time ago because we are afraid to die, right? So, but the young people, because they're infected and they run around, they're strong, they don't really take that seriously, but they become the reservoir of transmission. So I think we need a good pandemic management is knowing your population. I mean, knowing your population is that Africa is a very young population, and until we mobilize the youth, so we're going to go to them with a package of measures that they can support us and mobilize the youth to get engaged. The second thing is an active community mobilization. What can they do to facilitate engagement with religious leaders, civil society, and other community leaders? We've seen during our partnership with the MasterCard Foundation that each time you go to a country and you go to the churches, the mosques, and other places of worship, vaccination increase. Okay, we've seen this in Cameroon. Africa CDC has a team in Cameroon supporting the African Nation Cup. We have seen how the youth engagement has increased vaccination. We have seen how going to churches and mosques and making sure that the preachers or imam take leadership of that increased vaccination. So the head of states will need to champion that. They need to put resources, bring their own domestic resources to the table, which is logistics. I mean, we can't count on partners alone to mobilize vaccination efforts there. We at Africa CDC is working with the MasterCard Foundation as a $1.5 billion partnership to scale up vaccination, but it will not be enough for a continent of 1 point. So there needs to be domestic engagement. Those are the different packages that we're going to put together and then propose to the head of states to champion it.
Thank you, John. I think let me go online, and we have a question from Sarah Jerving, who's with DEVEX. Sarah, please go ahead with your question.
Thank you so much. What are the practical changes of an autonomous Africa CDC versus a specialized agency? And is this change endorsed, and what are the next steps forward for this? And I'm wondering in general, if you can just clarify which initiatives are just proposals and which are approved and now need to move towards a treaty. Thank you.
The first question I got, which is if I heard you right, Sarah, is what the autonomy means.
I think perhaps we should ask Sarah to come again.
Okay.
Sarah, can you just ask your question again? We didn't quite catch you.
It's an echo, Sarah, so it makes it difficult to.
Sure, I'm sorry about that. What are the practical changes of an autonomous Africa CDC versus a specialized agency? And is that change endorsed already? And what are the next steps forward for this? And then I'm wondering if in general, if you can clarify which initiatives are just currently proposals and which have been endorsed and now need to move towards a treaty. Thank you.
So for the autonomous health agency is significant, which means Africa CDC gets the statute almost equivalent, not almost equivalent. We have the same statute like the NEPAD, the AU NEPAD. So then the director will be called a director general, which is, and CEO, which will also be equivalent to NEPAD and other organs. So I think that is significant. Second is that, I mean, you have the director has, or the leadership has more authority to decide. So in other words, previously, if I had to dispatch people to, say, DRC or to Kenya to respond, what you do is that you write a memo, it goes to a commissioner, then from a commissioner, it goes to a chairperson. So if anybody in between there is traveling there, there's a lot of delay. But with this authority, you can actually today say where there's an outbreak in country X, you mobilize, you sign off, and then in 2 days, you deploy people in the field. I think that is the power of that. And then you, of course, continue to report to the commission, but it will be like on quarterly basis. You can actually have a standing meeting with a chairperson, Faki, on a quarterly basis to report. Very similar to what WHO and the UN does. I mean, Dr. Tedros doesn't go to the Secretary General Guterres to get permission to do anything, but they report. They have a different reporting mechanism. That is the power of that new structure. Now, the Executive Council. So first of all, the Permanent Representative Committee, the PRC, have signed up on that. The Executive Council has signed up on that. And now we are waiting for this summit. The head of states will need to sign up on that. Once that is done, then it now goes through the different committees now to see the structures. Okay, there's a structure committee. So it's no longer approval, but it's rather the implementation of what the head of states have agreed on, if that makes sense, because they agree, as I've said when I responded to Robbie's question, is the agreement is always at higher level. Then the details are worked out at a more technical level. So, but that is the direction that we are heading with this. With respect to the treaty or the APRA, that is a process. So the way the AU works is that you have to take that concept and present it, and then the principles it's agreed on, and then you take it forward and then develop it, flesh it out, and then present it to the different, what you call specialized technical committees of the Africa. So that the treaty piece and the APRA will take time, and maybe the course of this year, they'll work out the details until when they hit the gavel and say, good, we now have a treaty, or we have the African Preparedness and Response Authority. So that is going to be work in progress in course of 2022.
All right, thank you. Let's come back to the room and see. I see one hand going up there. Let me come to my left. So let's start with you.
Thank you. My name is Waruna from Shura News Agency. The Africa CDC is building its future headquarters on the outskirts of Ethiopia's capital. There are also plans to build the regional offices across the continent. How is progress on this so far, and what are the cooperation areas with China in realizing these aspirations? And I would like to comment on the task force, the health task force, and to elaborate this, the health task force, and when it's going to be operational, and is it endorsed by the heads of state and government? Thank you.
No, sure. Let me start with the second part, which is the report. The entire report that I just read to you and Professor Sisana has been adopted by the head of states. So now the commission, that is the COVID commission that Professor Sisana just outlined to you, will now go back and say, okay, good. The head of states have agreed on the need to establish a health task team. Let's set it up. Let's look at who has to be at the table, and then you flesh it out into the details of what is it that the team would do. So it will include a series of different cadres of healthcare, the nurses, the doctors, epidemiologists, laboratory experts, and whatever. And then each subgroup will determine targets. Okay, where do we want to be by the year 2030? So that is the work that is, then how do we finance it so that we get to where we need to be? So with respect to the Africa CDC, I'm very pleased with the progress. 5 years anniversary of Africa CDC. You can see the construction. I invite people who are in Addis to drive around that area and see the construction. We have continued to be very proud with the evolution of Africa CDC. If you also go to Gabon, you see a 5-story building, 5 or 6-story building that Africa CDC is occupying. And in Kenya, so I think in 5 years, we've managed to actually mobilized about 4 institutions, the headquarters plus the regional collaborating centers in Kenya, in Zambia, in Libreville, and in Nigeria. The center in Egypt is still under development, which is we still have to sign what you call the hosting agreement with the government of Egypt. So all partnerships are always appreciated. We have about 20 partnerships at Africa CDC. So Africa CDC is very open to partnerships, the partnerships with China, with the United States, with the UK government, with the French government, just to name a few. When you start naming things, you forget others. But I always make sure I don't forget the MasterCard Foundation partnership. It's a $1.5 billion partnership that is already in play. And of that amount, $100 million will go to strengthening Africa CDC over 3 years. So in Africa CDC is well resourced. The Gates Foundation has been an instrumental partner. The WHO, Geneva and Afro work very closely within the context of a framework. So Africa CDC has many partners, and I really want to end by saying that our needs on the continents are huge, and all partnerships are always welcome.
All right, we had a hand from the left. Please go ahead.
The thinking doesn't work. Thank you so much. Thank you. You mentioned Omicron and the people who have been tested positive in the past 3 days at the headquarters of the AU here. So do you have any statistics? What kind of variant of COVID-19 they are positive of? Thank you.
So the question was, what kind of virus they're infected with?
Yeah.
No, we don't have that kind of information.
Okay.
For now, yeah. That you need to sequence the virus, and that will take weeks to get that. We are definitely going to sequence those viruses, but that is not pertinent to this. That is not an urgent need to know the variant. The most important thing is to make sure that you are protected. Okay. Yeah.
All right, thank you. There is a question that has come through online, and this is coming from a colleague who's here at the African Union Commission, and she is Ledet Teka. And Ledet says, my question is, to what extent will the Africa CDC be involved in addressing pandemic response in fragile settings? What kind of framework do we have in place at the African Union level towards access to health in conflict and humanitarian settings?
So one of the things that in the new Africa CDC that is being the new status that is being developed and proposed to the head of states, there will be a need to have a framework that guides the way Africa CDC interacts across the different departments within the Commission. Over the last 2 years, Africa CDC has interacted with nearly all the different departments within the Commission. We started off with the Peace and Security Department and the Peace and Security Council, where we actually went to them and we arranged to have a military plane that took us to DRC to pick up responders there and drop them in Niger, Burkina Faso, and Mali. We work very closely with the Trade Department, of course, with the Department of Social Affairs. So there's a framework that will be developed as part of this new revision of the Africa CDC to be more responsive to others. Now, to do that, Africa CDC alone cannot go into fragile state or areas in conflict. We don't have the military. We must be enabled, which means we must work with the military wing of the continent to be able to do that effectively. But for now, that is work in progress. Underneath the framework that will be developed, definitions and specificities will be elaborated.
All right, thank you very much. I see the lady in front has a question. Do we have another hand?
Hello. Okay.
All right, please proceed.
Julia from Reuters. Hello, Director. So you said at the end of December that there was a significant amount of vaccines that had been wasted because their shelf life had expired. Does the CDC has any detailed data on how many vaccines were thrown away or which countries decided not to take the vaccines because of their shelf life?
No, we don't have. We have general data, which I think I presented to you a couple of weeks ago. And it was, let me hold back on that because I don't want to give a number that is not exact, but I recall that it was close to 2.8 to 3 million vaccines out of the 500 and something million vaccines that have arrived that had expired. That represents 0.5% overall vaccines that have expired. That's what I can say, but I don't know I don't have the specific country by country breakdown.
And where did you say that so that I can go back and find?
Oh, this was about 2-3 press conferences ago. I think our communication reached out to Promise. Promise
Okay.
can give you that press briefing.
And is there anything else you could add on the cooperation between AMA and the EMA?
AMA is really not. AMA is a separate agency from Africa CDC. So I don't know the details of what is underneath, who is talking to who in AMA. So I think I don't want to say things that would not be accurate.
But will you cooperate? Like what?
Sorry, Julia, I think perhaps we let this be your last question so we can move on to others.
Yeah. No, just what the relationship between CDC and AMA is going to be.
CDC and AMA, you mean not AMA and EU?
No, but you said you don't know about that. But then, like, follow-up question.
CDC and AMA, the best way to describe that relationship is that AMA and CDC are like the two lungs in the same body. So, I mean, we need each other. So imagine in future, so here we are at Africa CDC, just to use this as an illustration. Imagine that we are moving countries to producing vaccines, which is what Africa CDC is doing. Very similar to what WHO is doing, right? Mobilizing the South African, the Kenya, Rwanda, Senegal to produce vaccines. But Africa CDC doesn't have the authority to provide emergency authorization for any new vaccines that will be produced there. So you count on AMA to do that. So the two must work hand in hand. That is a very good example of how these agencies work. Very similar to the United States, where the FDA approved drugs, but the people that actually have a say on how to use it is the CDC. So that will be the relationship between AMA and Africa CDC.
Thank you.
Yeah.
All right, thank you. Do we have any more questions? I see none, both from the floor and from the colleagues who are online. So I think this is the time for you to summarize your main points.
Maybe Professor Susana, is there anything that she wants to say?
Professor, yes, thank you. Professor?
Yeah, I wanted to say that
questions and issues that have been raised, do you have a comment on any of them?
Yes, I have a comment with regard to the funding. At the
Professor, you are muted.
Am I muted? No, I'm not. Can they unmute me from that side because I'm not muted?
Only if you are muted.
We can hear, Professor.
From here, I am not muted.
We cannot hear. All right, now it's okay. Please go ahead.
Okay. I wanted to say, with regard to funding, President Ramaphosa is chair of Act A, which is the facilitating council that is responsible for accessing vaccine and health systems in terms of improvement of the health systems. Through that, which I co-chair at the technical level, we've been able to raise $18 billion, because President Ramaphosa would send letters to the heads of state together with the Prime Minister of Norway. So we've been able to get enough resources to be able to start to provide vaccines through COVAX, through many other agencies across the world. So I don't see a big problem insofar as having the APRA system being financed, because we have the capacity to be able to raise funding. The other thing I wanted to mention is that with the global funds that are going to be set up through the Financial Intermediary Fund, we do expect that when that money is actually allocated, it must actually be allocated through this structure that is being set up in our, the Africa structure that is actually being set up for funding. So I'm not really worried too much about the fact that will we be able to get, at least sufficient to be able to start implementing programs when a new health emergency arises. So that's one thing I just wanted to strengthen.
Thank you very much, Professor. Perhaps let me start with you in terms of summarizing one or two key points that you would like the audiences to take away today.
Oh, okay. I would like to say that the commission is an important initiative that has been set up. And because it cuts across the whole of Africa, it allows for them to consult on all those decisions that have been taken by that have been taken, at the meeting of the heads of state, at the summit. So they are going to be able to talk on all of the 6 regions with key stakeholders in order to be able to move that agenda. Secondly, I want to say that the commission that has been set up has really been able to achieve a lot at a relatively short period of time. They are committed people, they're intelligent people, they are really people who are embedded, in various structures in our society, and they will be able to assist President Ramaphosa in terms of his championship in Africa. That is all I wanted to say, and thank you very much.
Thank you very much, Professor. Over to you, Dr. John, for your main highlights.
No, thank you. I think number one highlight is the commitment that the head of states are taking on to lead the vaccination efforts. We are in the middle of a pandemic. Vaccines are beginning to arrive in a more predictable manner, and we need that political leadership and oversight to make sure that we vaccinate at scale and at speed. And I'm also very truly excited that we will be, in the coming days or weeks, be launching a youth program that will galvanize our youth so that they really take ownership and leadership in the vaccination program, including self-testing. I mean, you hear the next week going forward, guidance begin to come from Africa CDC on self-testing, because we really want to democratize self-testing so that people can, in the community, be able to take a swab their throats or nose, put that in the tube, and then know their status so that you can actually isolate yourself from the community. So that goes hand in hand. The second thing that I really want to, that is exciting for me during this conference is really the commission, the work that Professor Sisana has mentioned. In my 30 years career in public health, I've never seen the head of state under the leadership of President Ramaphosa exercise such hands-on exceptional leadership, where the commission is doing the work that oftentimes you hear about a commission on health in Africa, but it's run out of Europe or the United States. But this is the first time that is actually run within the continent. I would challenge anyone to show me if there was a commission after the after the Ebola outbreak in West Africa, which was devastating. And everybody said never again, but there was never a body in Africa that sat down to think through it carefully and learn lessons from it. Lessons were documented during the Ebola outbreak in West Africa, but lessons were not learned. This commission is really providing us an opportunity to learn a lesson, which means you learn a lesson that after an event has happened, if you try to do something to resolve it. We are beginning to see the outcome of the work from the commission that was presented by Professor Sisana. And lastly is really a program that we also plan to launch in the coming days, which is a program to attract Africans who are in the diaspora to come join us in the fight, where they can come in here and rotate for about 3 to 5 months, okay? And we learned that during the COVID, when President Ramaphosa put in the task force called the AFCOT to coordinate the technical work, a lot of Africans in the diaspora were contributing. Every Tuesday, they were called in as part of the technical working group. But we want to create an enabling environment that they can come in and we support their travel, support their stay, and we can place them within different countries so that they can use their expertise. A lot of African expertise are out there that we can tap on to fight these pandemics, and we need to create those enabling environments. So watch out for those initiatives in the coming days when we finalize them and begin to launch them. So that is all. But again, wishing all of Africa CDC a happy 5th anniversary. We'll continue to celebrate it this week and who knows, all of 2022.
All right, thank you very much. So colleagues, that brings us to the end of this press briefing. Let me say a big thank you to Professor Olive Shisana, And Professor Shisana is the Special Policy Advisor to the President of South Africa. And she was talking to us today about the African Union's COVID-19 Commission and about its work and members of that commission. We also heard from Dr. John, who had quite a big agenda, but he managed to go through everything as well as to take your questions for today. I want to thank colleagues who are in the room who took the time to join us for this briefing, as well as those who are online for your usual support and participation in these briefings. Thank you very much to the team of the African Union and of the Africa CDC, as well as the interpreters. Well, they are part of the African Union Commission, but they have that special role of making sure that we can understand each other in the different languages that we speak. So thank you very much. We will join you again on Thursday, online this time, at the same time. Bye-bye.
Thank you.